Rising costs of health insurance as Obamacare subsidies are set to expire at the end of the year, and premiums are also spiking among employer-based plans. The nonprofit KFF's annual study finds the average cost of a family health insurance plan has hit nearly $27,000, up 6% from last year and outpacing inflation. That's what's alarming about it. Joining us now to talk more is Dr. Anahida Dua. She's a vascular surgeon and founder and chair of Healthcare for Action. Lovely to see you. Thank you for joining us.
Thank you.
All right, so this study, it actually also points to rising drug prices, particularly for the weight loss drugs, along with the prevalence of chronic diseases too, hospital prices, among other factors. What does this increased spending mean for patients navigating all this as costs? Look, they're increasingly having to be passed on.
Well, it means one big thing. They're not going to do it. People literally cannot afford $27,000 a year. Even in my family, I have a family of four, and I'm obviously decently well off. Our costs are $20,000 a year, which is a significant hit. I can't imagine what it would be like for someone, and that's a lot of our country, who couldn't even afford the extra $400 premium. In fact, there was a study, the Fed Reserve actually looked at it and said that 40% of our country would not be able to absorb even a $400 increase per month. So to answer your question, patients are just going to say, I can't do this, and I'm not going to do it as a result.
And just not.
Exactly.
Or delay it until things, until plans end up changing down the track.
Right.
Yeah, and the doctor that we sort of opened up this segment with, I interviewed him yesterday. He said there's actually a rush right now for a lot of people to get their treatments, get their drugs, get whatever they need, not just for themselves, their parents, for their kids. What are you noticing that? Are you noticing that too?
Oh, absolutely. People are trying to push things. And this happens actually every year when we start to deal with changes in insurance and enrollment, which is really sad. Actually, the #1 cause of bankruptcy in the United States are healthcare bills. Even the segment you just showed a second ago, I mean, how sad is it truly that Taylor Swift has to give $100,000 to a child with cancer? You know, there's a problem in there, right? And so at this point, really, what the key point is going to be is not a Republican or Democrat thing, but really just an overhaul of this healthcare system such that these drug prices and the cost of care does not bankrupt families. And unfortunately, now with about 4 million people who are going to leave healthcare because of what's happening with the premiums, we're going to see a rush to the ER for people to get the care that they should be getting preventatively.
Right, which is more expensive, and then that drives up costs for everybody else if that trend continues. Look, I mean, chronic disease is just absolutely out of control in this country right now, and recent studies have found that cancer rates are rising among people under the age of 50. What do you think is contributing to this? While you're here, just want to get your take on this, as chronic disease is just rising alarmingly.
It is across the board. So, you know, I'm a vascular surgeon, so we see a lot of cardiovascular disease and, you know, diabetes, and that leads to things like being on dialysis. Of course, that leads to amputations, heart attacks, strokes, and then, as you mentioned, cancer happening in people younger. There's a myriad of reasons for why that would be, including the things that we eat, genetics, of course, and what we're exposed to, and then levels of stress in general. You know, you ask people to pay $27,000 to keep their family healthy. That's going to keep them at a level of cortisol in their body that's too high. So all of these things are contributing, and the fact of the matter is that it's just becoming more and more difficult to have the basics in life, unfortunately, in the United States, and this is something our government needs to help us handle.
Yeah, rising costs for everything, not just healthcare, but you know, sort of across the board. You wonder if that's one of the main contributors to the falling birth rate in this country too. Doctor,
Absolutely.
Thank you so much for being here. I really appreciate you weighing in.
Thank you very much for your time.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.